Good morning, guys. Tony Maritato here, licensed physical therapist. So in the Facebook group, Total Knee Replacement Support Group for Kind People, somebody was asking about chair scoots to work the hamstrings or the quadricep muscle. So I'm going to show you what that exercise looks like. Talk to your physical therapist if you think this is something you might use at home. But basically, I'm in a standard office chair. Now, the concern is always whenever we let somebody sit in a chair with wheels, if you're not really strong, really stable, comfortable getting up and down, the concern would be that the chair moves and you fall. That's the reality. So I'm not recommending that anybody do this exercise, but for those of you who wanted to see the exercise, I'm going to show you what it looks like. So basically, there's a couple different ways to do it. If I want to work the quadriceps and I want to work knee extension, really simple. I push back, and so what happens is I can do it in a walking pattern, or I can do it both legs together, kind of pushing me back. If I want to work the hamstring, I want to work the back of the upper thigh, I want to work knee flexion, bending. I can do the same thing pulling myself forward. And just like in the previous example, I can do both legs together, or I can do one leg at a time. Now, obviously, it's going to depend on how thick the carpet is. The thicker the carpet, the more resistance. It's also going to depend on how well the chair rolls. Most of these chairs will kind of roll in unequal patterns. They'll move around a lot. That's part of the exercise, because what happens is, as I'm walking backward, I have to kind of control where the chair goes. So I might have to push laterally, push straight, push medially. Same with coming forward. Now, if I face the camera, same thing. As I walk back, I'm doing quadricep and knee extension. As I walk forward, I'm doing hamstring and knee flexion. So it's a great little exercise. It's easy to do. It works best on low pile carpet. Hardwood floors or linoleum, kind of a little bit too easy. It doesn't work so well there. And then of course a thick plush carpet, you're barely going to be able to move. The safety concern would be if you go to get up, obviously we don't want the chair to slip out from behind you. If the carpet is too thick, when I'm pulling myself, it's easy enough to kind of slip off the chair. And then of course, if the carpet's too thick or I'm too far back in the seat, it's reasonable that the chair could tip. So I try to position my patients somewhere toward the front center of the chair. And I also always spot my patients when they're doing this exercise so that I can be next to them in case they get uncomfortable or any safety concerns come up. So guys, if you have questions like that, let me know down in the comments. If you're not already a member of the Facebook group, go ahead and check it out, and I'll catch you on the next video.